Hi, my name is Mohammad Fahad Nahian. I'm a student of University of Wollongong. Before I begin, I would like to acknowledge the traditional custodians of the land on which we gather today, the Dharawal people, and pay my respect to elders past, present, and the emerging. I extend that respect to all Aboriginal and Torres Strait Islander people here today. Now imagine being a child in a world where getting the healthcare you need feels out of reach. Not because of the illness you have, but because of where you live, who you are, or the challenges your family faces. It's hard to imagine, right? Yeah. But this is the reality for so many children in New South Wales. They come from the diverse background, like some of them are from the Aboriginal communities, some of them are from the refugees, uh, some of the children with the disabilities, or those in out of home care service. Like the Peace Project is about changing the story. It's about the giving the children not just a hope, but the real access to the healthcare that is not only effective but also currently safe, culturally safe, and respectful of who you are. Today, I am here to share with you how the Peace Project is making that happen and why it matters so deeply. The Peace Project. The Peace Project is actually launched in the 2021 as a part of the border strategy by the New South Wales Ministry of Health to improve the health outcomes for the vulnerable children. Actually, it's a 3 years initiative. It will running until 2024 and is a part of the pediatric priority funding 2021 to 2024, which supports projects that enhance the healthcare access for children with the complex needs. Like the project is actually leads by the Sydney Children's Hospital Network, who are the leader in the pediatric care across the New South Wales. Their goal is pretty simple, like provide timely, culturally safe, and enhanced care to those who need it the most. One of the most powerful elements of the Peace Project is its the commitment to the cultural safety, especially for the children from the priority population, including the Aboriginal and Torres Strait Islander children, refugees, children with disabilities, and those in out of home care. These children often face significant barriers when it comes to accessing the healthcare. Like for many Aboriginal families in particular, there is a history of mistrust due to the past experience of discrimination and the lack of the cultural understanding. Like Peach is working to change this narrative by making sure healthcare is currently appropriate and respectful. This means that when an Aboriginal children or a refugee families walks into a hospital, they are treated with a dignity, with the respect and understanding the way they deserve. It's about more than just the medical treatment. It's about ensuring that care with honors their identity and the cultural values. For the Aboriginal children, this could mean healthcare providers who understand their connection to the land and the community. Or for the refugee children, caregivers who acknowledge the trauma that they may have experienced. The goal is to rebuild the trust in the healthcare system and to make sure these children and their families feel safe in every step. The Peace Project goes beyond just the medical care. Like it looks like the whole picture of a child life. Health isn't just about the treating the illness. For so many children, it's the social determinants, like the things like where they live, about their family income, or whether they have the stable housing or not. That determine whether they get the care they need. Like think about it, a child living in a poverty, or come from a remote community, without access to nearby hospital, already start off with the barriers to care. Peace works to break down these barriers by focusing on the social determinants of health. The project helps families overcome challenges like the lack of the access to the healthcare, unstable housing, or limited community support. For example, families struggling with the financial, maybe linked to the social workers who can help them to get the uh, get access to the resource and the services. Peace is also making sure that kinds of difficult situation get the early intervention they need. It's about giving these children for a fair chance. It's about creating a level playing field for all, so that the child can grow up healthy regardless, with the background and with their circumstances. The service provided by the Peace Project is not just about the medical care. They are about the changing lives, and as I mentioned before, at the heart of the piece is the idea that every child, no matter where they come from, what challenges they face, deserve the best possible start in the life. One of the key service is the early identification. By using the advanced electronic medical records, children who need help most are flagged early to ensure they are not left waiting for the care that could make all the difference to their healthy future. What makes Peach truly special is its focus on culturally safe healthcare for Aboriginal and Torres Strait Islander. For example, care isn't just about treating an illness, it's about the understanding and respecting their culture, their tradition, their community, by making sure that healthcare is delivered in the way they deserve. Like many children, especially refugees and those in the out of home care, they are dealing with a trauma that impacts their everyday life. Peach ensure that they get the emotional and physical support they need, not just themselves, but their families too. But when a child's family is supported, the child is more likely to thrive. Peach is also emphasized on assertive follow-ups. This isn't just about the treating a child once and moving on. It's about the healthcare terms and actively following up the children for their well-being and getting the service they need. The level of coordination is the key to ensure no child left behind, one of the most exciting aspects of this project. Imagine being able to receive high quality healthcare without needing to travel hours to hospital. That's what telehealth can offer. It's about bringing the care to the child, whatever they are. This service works together to build trust in the healthcare system, and trust that these children will be taken care of. In the long run, this means better health outcome, stronger community, and children who are able to growing up feeling safe, support, and healthy. So, I have some recommendation for the improvement. While the Peace Project is already making a powerful impact, there is still some important areas that can we can make it more even better. The first recommendation is to expand the cultural safety training for across all the health providers. It's not just about the treating a patient medically. It's about understanding their background, their culture, their community. For that, they can hire more and more uh, Aboriginal staffs that who can understand their language, their culture more accurately. Like every healthcare worker who interacts with these children, from doctors to administrative staff, should have the training to ensure that the care is delivered with the respect and sensitivity, especially for the Aboriginal children and the cultural diverse family. Another area for improvement is the data integration. Right now, different health services don't always communicate as effectively as they could. By improving how health data is shared across the system, we can ensure that no child healthcare journey is interrupted. When healthcare providers can access up to date information, children receive faster and more coordinated care, which could make all the difference in an emergency situation or long term treatment. Lastly, I strongly recommend to expanding the healthcare service for the children, like the telehealth service, like who are living in the rural or remote areas that can help. This simple improvement could mean a world of different for children who need continuous care but live for medical facilities. Thank you.